Everybody, it's Mo, and here I am. I'm gonna take you through a couple exercises or maybe 20-minute routine on movement flowing. It's gonna make your body relax, that's our intention, and not to stress on this, but just to kind of allow tissues to open up and to soften and to lengthen into a stretch, not force into a stretch. So the first thing we're gonna do is just take your leg, your top leg, since you're on your side and your head is resting comfortably, and you're going to realize that you can internally rotate, externally rotate your femur from your hip. So we could do that and swing it around, maybe even make a figure eight movement, sideways figure eight, infinity sign. All right, and then we could start to lengthen out the knee and straighten the knee. Rotate down and just sort of float around in your own three-dimensional space. Then relax. You can work your ankle, you can work your toes, you can work your knee, you can rotate out, rotate in, and we're going to do this for a little bit longer. Now, secondarily, you can add an arm in on that and sort of let the arm float around randomly as well. You may find that the arm and the leg do parallel movements. Try to disrupt that and make them each go their own way. And just check it out. You've got a wrist, you've got fingers, you've got an ankle, you've got toes, you've got over your head, behind you a little bit, and just keep moving. Relax and breathe. And just keep it going a little bit longer. See how your hip feels. You can reach your leg up and see how your hamstring lengthens out here. You can flex your foot. I can't see it, I'm not on the camera. You can flex your foot, point your foot, flex and point. You can do the same with your wrists. Stretch your fingers apart. Stretch your toes apart. Just keep that random flowing motion going for a little bit longer. And the arm too, nice stretch overhead, nice reach to the front, maybe leg reach behind, opposite arm to leg goes back, and up, and there we go, and that's enough. Let's change it over to the other side. I gotta flip over, okay? And there we go again. We're sideways or laying down. Support your head. And then we're just going to get this here leg, this one, moving around a little bit, random. Just get it going in kind of a nice smooth flow pattern and see how things are feeling. If you're feeling really tight, then the job is to kind of relax or, just keep warming up and tissues will start to soften. Use your ankle, use your foot, spread your toes apart, point your toes. And then we can get the arm going as well. So it's just a really nice flowing exercise. It's random, floating around in the water, rotating the hip, bringing it down, bringing it up. Reach the arm forward, bring the leg behind. And if your back hurts you at all doing this, I suggest you engage your abdominals just a little bit. And if it still bothers you, then I suggest that you make the movements a little smaller. Okay, we're already going slow. Yeah, so please, this is not a fast exercise. This is a lazy, slow exercise. Although you may find that you're getting tired. Okay, a few more seconds, and keep it going. Work your ankle, work your wrists. No, single wrist, just one. Okay, and there you go. That's really fine. Okay, what we're going to do next is take your top leg and put it back behind you. Okay, and then we want to bring our ribs down in the front, engage your abdominals a little bit, and now this top leg is getting a stretch in your quadricep, and you can pulse a little bit. If this hurts your knee, then I want you to come out of it and massage the tissues around your knee until it doesn't hurt. Then you can check it out again. If it still hurts you, then just don't drop it down quite so far. But as you drop your knee, you just allow it to kind of migrate its way to the floor. You're going to feel a little stretch going on in your IT band. That's the tissue that's right on the side of the hip, coming down to the side of your knee. Okay, so that's a nice stretch. Okie dokie. From there, take that same leg and now stretch it out into the front. So it's kind of even with its own hip. And then we're still supporting our head. I'm just holding it up with my hand. And so what we're going to do now is rotate your hip. Keep your hips stacked. We're going to rotate so your toes are pointing downward. And then we're going to rotate the hip. I haven't done this for a while, so it's not going very far. But we're going to rotate it to try to get the foot so it points up. And then rotate down. This is easy for me. This is not. I need to work on it. And then rotate down, pigeon toe, and then duck toe on the up phase. And one more, down we go. And up. And hold it, hold it, hold it. That's fine. All right, let's flip it over and do the same thing on the other side. Okay. So first thing we're doing is taking this top leg, bring it back behind you, support your head again. And this is going to give you a stretch right in the front. And we're just going to pulse, just allow the hip to relax with every little pulse that you do. And the knee might find its way towards the floor. Doesn't have to touch the floor, but I'm hoping you're getting a stretch on the top of the hip. I'm having a little discomfort in my knee. So, as we all know, we come in and massage, because a lot of the discomfort that any of us might have is just connective tissue that's kind of stuck. So I'm going to massage that for a few seconds with my thumbs, and then check it out again. And that discomfort's gone. It's magic. Okay, and then I'm just going to pulse a little bit. All right, now I'm feeling this stretch up here. Before I massaged out on my knee, I just felt pain at my knee. Nothing going on in my hip. Now I feel my hip. That was my goal. That's what I was trying to find. So I'm very happy about that. Okay, and now I'm going to take that top leg and I'm going to bring it out in front. I'm going to rotate my leg so the toe points down. Yep, and again, for me, this is all very comfortable. You can straighten out your other leg if you choose. That would be fine. So internal rotation of my leg, simple for me. External rotation, haven't done it for a while. Wow, that's feeling in the hamstring in the back. Actually, if I come in, maybe magic, and massage in there where I felt it pull, I might be more successful. So now I'm going to try it again. So I know that the down internal rotation is easy. Let's try the other. Yeah, it's a little better. I could still use more soft tissue work back there to make this respond better. But let's see where it goes as I internally rotate and then externally rotate and internally rotate, externally rotate, and we're just going to do it one more time. Internal, external, and I'm going to hold it, hold it, hold it, hold it, and that's fine. I'm going to turn over on my back. I think I'll come in a little closer to the camera. So I'm on my back, and I'm going to take this is my right leg, I'm going to take my right leg and bring it up on my left leg, and just come on up for a glute stretch, okay? And I'm just gonna not force this. I'm gonna notice what tissues feel tight. Sometimes it feels tight in the back, sometimes it feels tight on the inner leg. And right now I feel pretty comfortable. But I can feel a little bit at my knee, so I'm just gonna come out of that position and use my knuckles. Come in where the area felt sore, tight, painful, and just move that connective tissue around that's under the skin. And then I'll try it again. And that's way better. Now I feel it in the back. You'll find as you release one part of you that something else is going to show up. And then you can go in and work on that next part. It's like peeling back an onion. Okay, the whole goal again is to get everything nice and comfy. All right, and so I can just kind of at this stage do a little circular pattern. I can relax my shoulders, relax my hips. Just have a nice old time. Everything's feeling very good. And you know, if you're watching this video and you want to keep doing this a little bit longer, that you can just pause your video and keep going. I could do this for a couple more minutes. It just feels great. And let's now move on. We'll change it. You also know on your video that, on your YouTube video, that there's a way to slow it down. So it's going at half speed or 3/4 speed if you want to do that. Okay, so here I am on the second side. This side feels fine. Feels good at my knee. I remember back that I already interacted with that knee and massaged it, so that's feeling very well. Yep, just going around in a little circular pattern. This massages my sacrum on my low back. It's actually not low back, it's pelvis. Okay. Alrighty then. So now I'm going to put both feet on the floor. I'm going to have my knees bent. And this time what I'm going to do is keep my ribs down. I'm going to think about my rib cage. And I'm not going to allow my rib cage to pop up as I do the work. And I'm just going to lengthen out my right leg and lengthen out my right arm at the same time. And we call this a traction stretch. The point is not to flare your ribs up, but to keep your ribs down on the floor. And then reach, don't overdo it, stretch out with your foot. You can press up through your heel. You can reach with your arm. Don't overdo it. And then we're going to come back to where we started. And we're going to check that out on the other side. I'm going to flex the foot down there, keep my ribs down, and just stretch. You can flex your wrist as well if you want. That all feels good. And then I'm going to go back to the first side. And we're just going to kind of float to one side and then to the other side. It feels good. I'm breathing. I'm relaxing my shoulders. I'm not stressing. I'm going to come out of that. And again, flexing the foot, maybe flexing my wrist, lengthening. It's almost like first thing in the morning when you're getting out of bed and you're yawning and stretching out. Let's do the first side again. Stretching out. And let's do the second side again. And stretching out. And come back to the first side. Here we go. Lengthening. It's nice and smooth into the movements. And breathing. Great. Next, roll back to your side. And I want you to take this top leg. Doesn't matter what side you're on, because we'll do the other side soon. You're going to take this top leg, bring it out in front. So I'm stacked, my hips are stacked, my shoulders are stacked, and I'm going to take this top hand, and I'm just going to let it reach forward. I'm not going to force it. I'm just tractioning again, stretching gently. And then I'm going to take a breath in. And I'm kind of all closed down in the front. Really, the only place the air can go is into my back, so I like that. I want you to try to do that. And let's do it again. Take a breath into your posterior rib cage. And now as we exhale, we're going to start to rotate. I want you to take your fingers, put them on your sternum, and guide your torso rotation. So my arm is still on my hand, rather on my chest. All right? And I just want to use my hand to guide a torso rotation. I'm going to take a breath into my chest Probably the top chest is going to be easiest to get the air in. And then I'm going to exhale. And guess what? With that exhale, my shoulder just went right down on the floor. Didn't have to force it. It just went. I'm going to inhale again into that top chest. And exhale out. Relax into that and just let your body be comfortable and calm. Okay. I'm going to breathe in. And on the exhale, I'm going to come back to the front where I started from. So I'm going to reach forward and just lengthen my arm and my shoulder. And from this position, I'm not stressing. I am going to take a breath into my posterior rib cage again. So here I go. That feels really good. And then I'm going to exhale. And I'm going to inhale again into the posterior rib cage. And on the exhale, I'm going to open up again. And this time my shoulder is on the floor. That allows me, if that rule is true, I can open my arm up. If my shoulder's not on the floor, just keep your fingers on your sternum and keep encouraging the torso rotation until your shoulder's on the ground, and then you can open your arm. Let's take a breath into this top chest again, and then exhale out. I'm getting a nice stretch in my hip as well. Okay, one more breath into my top chest. And then exhale. Relax. Just sink into the floor. Just let everything go. All right, guess what? We're going to do it on the other side. Switching over. Okay, here we are. So same deal as the other side. We're going to take your top leg and put it out in front. And you can rest your head down on your arm. Don't let your head just hang down to the floor, though. That's tough on your neck. Okay, and if you remember, what we did is we stretched the top arm forward. And that gives me a stretch behind my shoulder. This is my right arm, by the way. So I'm getting a right shoulder stretch by the blade, by the shoulder blade. Okay, and then I'm going to take a breath into my posterior rib cage. So I'm going to breathe in and exhale and relax. And then breathe in number 2 into the back of the ribs. And on this exhale, I'm going to open up. So I'm going to take hold of my sternum as I'm exhaling. I'm going to guide my torso open. Yes, I am. And this side's already, my shoulder's already on the floor. So I felt safe to open my arm up with that. And that works out just fine. I get a nice stretch in the hip. My torso is very comfortable. I get a nice stretch in my chest. But if I didn't have the capability of rotating so well through my torso, and I was only this far over, I don't want you to pull with your arm to get the rest of the way over. You'll dislocate your shoulder. So you gotta get the torso doing its thing first. And yeah, shoulders on the floor, now the arm can open. All right, so we're there, or maybe we're only here. Who knows where we are, but an appropriate place for you. And we're gonna breathe into this top chest. So expanding the ribs. I don't want you breathing into your belly. I want you breathing into your rib cage. So we're stretching out all those little rib muscles. And then exhale out and relax into the floor. And let's do that again. Inhale. And as you exhale, we're coming back to the front and reaching forward. Little bit of a stretch. Don't force it. And don't force it. Now breathe into your posterior rib cage again. And exhale and relax. The breathing can really help the tissues relax and allow you to stretch a little bit more. And let's inhale one more. That's a nice stretch back there in my shoulder blade. All right, and then on the exhale, we twist, torso rotate, gently guide your torso from your sternum. If your shoulder's on the floor back there, you may open your arm up. All right, and then we're going to breathe into the top chest again. So we'll take a breath in, and then exhale, relax to the floor, let everything chill. It feels so good. You could just kind of hang out here for an hour or so, but I wouldn't. Got other things to do. Okay, so now we're on the floor on your back, and I want you to bring your one knee up towards your chest. Again, don't force any of this. Secondly, you can straighten out the other leg. And don't force. You can pull this leg up really, really tight, but I don't want you to fight it. I don't want you to do that. As I stay here, I'm feeling a nice opening stretch in my quad on the other leg, so that's a nice benefit. All right, I like this position. Now I'm feeling a stretch at the top of the hamstring. It's not causing me any distress, just very comfy. All right, from here, I'm just going to take this knee and angle it towards its own side shoulder. So you can see I just opened it up just a little bit, and I can support it with my arm. I'm feeling a stretch on the inner leg. This second leg is feeling very nice. It's all stretched out on the top, and this feels excellent. Now, if you want, you can do breathing with this too. So you could take a breath into your chest and exhale out and just relax into this inner leg stretch. Okay, that's feeling more comfy. All right, I'm going to bring the leg back so the knee is straight up, and then I'm going to guide this knee towards the opposite shoulder. So I'm kind of pulling it across my midline. I'm getting a bit of a stretch out in my hip. That feels good. I'm going to breathe in again here. Breathe into my rib cage. No, you breathe into your rib cage. I'll breathe into mine. So here we go. Inhale into the ribs, and then exhale and relax. You may feel that you can get a little further in the stretch. We're going to inhale once more, and exhale. Yep. I'm trying not to twist at my low back, so I could bring this knee all the way over and touch the floor if I chose to, but you can see I'm not. I'm choosing not to do that so that I avoid stretching my lumbar spine, my low back, and I just get the work in my hip, and that's the point. Okay, let's come out of that. Great, and I'm going to just turn around to the other side to face you so you can see what I'm doing. Okay, all right, and then we're going to bring the other knee up to the chest. My knee's a little sore. This is a knee that's swollen and a little injured these days, so I have to baby it a little bit. So that should be enough. The second leg goes out straight. I'm going to bring this first knee up towards my chest. Yep. And the knee is fine at this point, feels good. I'm not forcing anything. I'm just going to wait here for a brief while. Let's take a breath. So take a breath into your chest again. Again, we're not belly breathing. We're trying to stretch out your intercostals. Those are the names of the muscles that occupy the space between the ribs. So let's do that. Let's inhale, expand your ribs in all directions if you can, and then exhale. And all the way and relax. Okay, we've been here for long enough. Let's take this knee and just angle it open. It's a little twist. And you're angling this knee towards its same side shoulder. Okay? And this second leg is down on the floor. We're trying to let that stretch out at the top so it can rest comfortably on the floor and not be lifted up at all. Okay, we want it to lengthen. All right, and then secondly, we'll come out of that. No, bring it back. Let's do a breath with that. So we're going to inhale into the ribs and exhale. When you breathe into your ribs, it doesn't mean do it high with a shrug. It just means expand your rib cage. All right, and then we're going to bring the knee that you're stretching and cross the midline. Getting into my hip again. I'm not twisting over. That's not the objective. The objective is to get into your hip. All right, so here we are. It's in a good spot. And I'm going to breathe in and exhale out. On these exercises, when I'm breathing, it's always rib cage breathing. And I'm going to breathe in again. And exhale out. And now I'm getting a better stretch in my hip. One more time. Inhale. And out. And that's fine. Alrighty. If you feel a pinch on the inner leg when you cross over, maybe the next stretch that we do will be helpful. So here we are, still on the floor, knees bent. Earlier we did a crossover stretch. We call this a figure 4 stretch. What I want to have you do is take that same leg and thread it underneath. I call this an inverted figure 4. And this is going to stretch the area that I said potentially was getting pinched when we pulled the knee across the midline. Okay, so I'm trying to keep my pelvis down flat on the floor so not get pulled over with it. Maybe it's going to mean the knee only goes down that far. That's the way it is, if that's the way it is. Okay, so at the same time, I'm going to take the same side arm and stretch it, but I'm going to try to keep my ribs down. So I feel my ribs on the floor underneath. And I'm just going to breathe and stay here with this. Breathing, breathing. Okay. Okay, I'm going to bring this knee back up again. Again, you can hold the position a little bit longer if you want. It's all relaxing though. Okay? Then I'm going to take the same side foot, and you can see I'm walking it out to the outside. And then I'm going to let the knee narrow roll back towards the midline. And this is a twist in the leg. If it feels awful somewhere, you go in and massage. So there really is a twist going on in these tissues, and they just may not be used to it. So don't force it. But once you're in a comfortable position, then take your same side arm again. Ribs down. No flaring up. Ribs down. And we're just going to stretch that out a little bit. Little pulse in that knee as long as it doesn't hurt. Nothing should hurt. Nothing should be forced. Okay, great. Bring this knee up. Bring the arm back to where you started from. And let's do the other side. I'm going to flip again. Okie dokie. So we're doing the inverted figure 4. So remember I said earlier we did the up top figure 4. This time we're going to take that same foot and put it underneath. All right. And there we go. It's a nice stretch. Try not to let yourself get pulled up off the floor from that other hip. All right. And then straight arm stretched with it. Keep this knee pointing straight up. And if this feels uncomfortable, you can come in and massage wherever it feels tight, and that would be great. And breathe. You never, ever, ever, ever want to be holding your breath. That will tense you up very quickly. Okay, so this is starting to release a little bit because I'm allowing myself to relax. Yeah? Okay, I'm going to bring this knee back up. Also, I want to make sure that I'm not arching my back, so I could correct that, check that out, bring my ribs down a little bit. Okay, I'm going to bring up this leg out. I'm going to walk it towards the camera, towards you, and then let the knee rotate back to the midline. And I haven't done this one for a little while, so some of these tissues under my leg are getting a nice spiraling kind of effect. Stretch my arm with that. If you feel any pressure at your knee, come out of that and do a little massage. Use your knuckles. They work really well. And then we're back into place working on the stretch. Alrighty. Good, good. So let's walk this foot back into the middle. And okay, we're gonna be getting up in just a second or finishing. And whenever you get up off the floor, a lot of times in the past I've seen people get up by going like that. I want you not to do that anymore, but to roll to your side and come up in a triangle position. I'm not gonna sit all the way up because then I won't be in the camera anymore, but yes I will. So there, that's how you would come up and come up on your knees and then continue. But I just wanted to say that that's a little hip opener. This is a great stretch, by the way, too, if you want to lean forward onto your leg. Thump, 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 that's a great hip. And then we can switch legs around. Lean on over, that's another great hip stretch. But that's all I got for you for now. So hope your hips feel really awesome. And I'll see you soon. Goodbye. Goodbye.